I want to start off by throwing this at you, Dr. Parsons. How do I know which COVID-19 vaccine information sources are accurate? Who do I trust?
I think that's such a great question. So I would say two places, and it kind of depends on who you trust. I personally am a public health professional, and I'm comfortable with the information that New York City Health Department puts out. I worked there for 7 years. Like, I know the people who are putting out this information, and I know the level of rigor needed to put out this information. That's my personal source of trust. I work there and I know them. Same thing with the CDC. The CDC is an incredibly well trusted organization. People think like, oh, the CDC, like, they're very political. They have to say this, they have to say that. That isn't true. It's actually the opposite. The CDC is precluded from saying anything about a product that's publicly available. Like, if you've noticed, the CDC doesn't talk about formula, tobacco, guns. They don't do studies anymore on like sugar and sugary foods and beverages and things like that because they've been told not to. So when they speak, I listen because they're not allowed to speak on everything. The CDC is not allowed to make remarks on gun control, for instance. They've been told they cannot. So I personally trust the CDC. However, I understand that that's not everybody's experience. Different cultures have different like relationships with government entities, and government entities have failed like different parts of populations. And so that relationship I appreciate is not for everyone. I would say that the other trusted source is generally your primary care provider. Most, I would say not all, primary care providers will give you like a good sense of what to do. Now, that being said, I know I've heard people say, well, I know doctors who are not getting vaccinated. And to that, I think like, that's cool. I know doctors who smoke. I know doctors who drive while they're drunk. Like, that doesn't make it okay. Like, not every doctor like is able to like follow in the footsteps of the things that they are like saying. Like, they don't always like say, they don't always do as they say. And so the fact that there are some doctors, to me, like, who aren't vaccinated or who aren't like, who aren't like pro vaccine, or who I'm kind of like, I'm used to that. Like, if you walk outside of any emergency room, you will see nurses and doctors out there smoking. Like, these are decisions that people make, and it doesn't make them bad people. Like, we all make individual decisions about our own health. But I would still say, for the most part, I would either trust the CDC, and we're so blessed in New York City to have a wonderful health department. I would trust our New York City Department of Health. But if you don't trust those entities, and I completely understand why that might be the case, I would say for the most part, like, trust your doctor, but make sure that your doctor is up to speed on the issues.
All right, thank you. All right, Dr. Watkins, does COVID-19 vaccines create or cause variants of the virus that causes COVID-19?
So that's a little complicated. So basically, viruses in their natural life cycle, they mutate. They adjust to what the situation is, certain things that are favorable and that help promote continuation of the virus to keep multiplying. Those things get passed forward. We see it with flu, we see it with other things. So we can see similar things in the setting of vaccines, where folks are vaccinated against certain strains, but certain strains potentially that have breakthrough or that bypass protections from the vaccines can actually lead to potential variants. That said, I think the biggest risk that we do have is in large sections of the population that aren't vaccinated. We saw, what we call the Delta variant coming out of that horrific spread that was happening in India, where we saw they ran out of all of their supplies and their medical system collapsed. And so vaccines are part of a bigger, bigger picture. I do just want to take a few seconds to acknowledge and really name this thing about trust and facts. Because I do want to say that it is not really, it's not illogical for many people on this call coming from the backgrounds and experiences that we do have to not trust some of these institutions. And this is me working at an institution, right? The National Public Health Service, they did monitor folks in Tuskegee and want to see what happened to them over time. This country did, enslave many of us. This country continues to oppress a lot of us. And so we're left in this conundrum, but what do we do now? How can we keep ourselves safe where so many of these facts are stacked against us and we have our own facts and our own beliefs, right? And so it's really an acknowledging that as community, we all come together in this, right? That's why we're here on this call tonight. That's why I'm here. That's why I work 12 hours today and I'm losing my voice. But it's because I believe that if we aren't serious in talking about this major threat, which is a COVID-19 pandemic, the virus itself, large portions of our communities will still be vulnerable to all of these other bigger things, but also will be vulnerable to this virus, which has killed us disproportionately, which is leaving our children as orphans, which is leaving us, many of us struggling to even survive and manage in this crazy world where they're storming the Capitol and all this other stuff. But it's like, how can we come together and really have the difficult discussion about how do we keep our communities safe from the deadly virus? We can talk about the vaccine, what it does do and what it doesn't do, which is address these bigger issues, bigger social issues, but we have to really look at what we can do to keep ourselves safe and not lose sight of this deadly virus that is doing what it's doing continually. And we're gonna have more than 1 million people dead from COVID in the United States, maybe by the year's end, but definitely before the end of the winter, which is something to really think about and sit with.
Understood. Thank you. Hold on, Ray. Oh, Dr. Devine, is that you want to speak?
No, I'm being quiet.
Oh, okay. No, hold on, Ray. I need to get through this. Dr. Lowe, it's a two-part question for you. Please put yourself on mute. What is the cause for new variants of a virus? Part one. And are there expiration dates, or do vaccines expire, especially for those variants that are surfacing?
I think Dr. Watkins addressed some of this earlier, and I thought he was pretty much right on track. COVID is one form of coronavirus, and the coronavirus is, I think, Dr. Parsons and somebody else, maybe a couple other people, have pointed out have been around a long time. So the viruses are always mutating, and the coronavirus, COVID-19, has certainly mutated. Just that one little branch of the COVID family has done a lot of mutating in the past year. So far, all the vaccines have worked, but I can't promise that that'll always be the case.
Okay. So expiration on a vaccine is part of the process to the team. Is that a
no? So not that it expires, but the vaccine is only, the vaccine is as good as it was created to be. The great thing is we have a lot of understanding and experience with vaccines, immunology, that we're actually able to modify the vaccine. And eventually, probably just like with the flu, depending on what variants are circulating, we can modify the vaccine to make it effective against a specific variant. So it's not that it will necessarily fall out of date or expire. It just depends on what is going on in the world, what the situation is, and if the vaccine is able to withstand and hold up, which the current ones have, even against the Delta variant. But who knows what next summer looks like, next winter, if we don't do things to severely decrease the transmission of this thing locally and also globally.
Yep. I think I can't echo, I would love to highlight, echo, and put sparkles all over what Dr. Watkins said. That's exactly right. At the end of the day, the vaccine, virus is like they all do the same thing, and that's what makes them so hard. I know I saw in the chat people are like, why don't we have a vaccine for cancer? Why don't we have a vaccine for HIV? Like, vaccines are hard because you're trying to create a target around something that's constantly shape shifting, right? And if you think about like the beautiful example that Dr. Watkins gave of the flu vaccine, every year we all have to go back for a new flu vaccine. It is totally different than the one that we got the year before, and the one that we got the year before that, and the one that we got the year before that, because there are people out there who try to predict how this flu virus is going to adapt and change. And they say, okay, it might go this way, it might go this way, it might go this way, it might go this way. So let's prepare a vaccine that kind of like addresses all of those things, and maybe like hits the most likely ways this vaccine will evolve over this virus, will evolve over a flu season. And like, let's create the vaccine now, because we've got to get it in production. It's really hard to get to like, hundreds of millions of doses of vaccine quickly. Like, you've got to at some point make a decision and be like, that's it. That's what we're going to go like into the lab with. And that's, I think, ultimately what's going to happen with COVID is it's going to keep evolving. There are going to keep being these variants, and whether it becomes an annual thing or an every 6-month thing, or who knows, like no one can tell you what's going to happen here. I think the most important thing is to continue to make sure that our leaders invest in the science and don't make this a political thing. It's got to be about the data. Like I first started, like we've got to just sit here and say, let's have a trusted source of data. Whether the data looks good or bad, who cares? Let's actually get a true source of data. Let us all know the truth. We can all draw our own conclusions from the truth, why it is so, like somebody failed, whatever. It could have been a different administration. Who cares in my mind? I just want to know the facts. What is this thing doing? How are the vaccines working? How long do they last? Do they work differently in different populations? Is there a reason to believe that somebody who's elderly might fare differently than somebody who's young? Is there a reason to believe that somebody who's Black might fare differently than somebody who's Asian or somebody who's white? We want to understand those things so that we know how to better equip our communities to protect themselves. And I think that at the end of the day, the data, we shouldn't be afraid of the data. But what I am afraid of is people overly politicizing the data. And as soon as they hear the data, like throwing up their arms and like drawing all kinds of conclusions before they even have a chance to understand, what is this telling us, and how should we react differently? And I have to say, I love this current administration for how much they understood about having to double down in disparity populations, in lower income neighborhoods, and saying this is where the vaccines will be delivered. I personally delivered doses up in the Bronx, and it was so important to me that was one of the first places in New York City that got vaccine doses before Wall Street did, right? Like the South Bronx got vaccine doses. We have to continue to take that approach to say, we have to take what we know about healthcare, what we know about disparities, what we know about like the differences in how people have access to healthcare, and let us leverage that knowledge and turn it into and make it part of our strategy of how we're going to address this pandemic. And only then can we even pretend that we have anything close to the equity that people deserve. And all of the issues that people have raised about why they don't trust government, I 100% hear you. I wouldn't trust a government that didn't value my life the same as it valued somebody else's. But still, I want more for that government, and I want to give them that feedback to say, please make the vaccine more available in harder to reach communities. Please try harder to convince people who are less trustful about the vaccine, and invest the time that it's going to need to build their trust. You're not going to all of a sudden build their trust just because there's an emergency, right? Like trust takes time.
All right.
Yes,
So
I want to commend and thank Dr. Watkins for his point that was made regarding the cultural sensitivities that we have and the history that we as Black and Brown people have had in America. But it's not just America that these type experiments with the Tuskegee has been perpetrated on Black and Brown people. We have to look at Africa at large. And I mean, it's not just in a historical context. These are things that are still ongoing with pharmaceutical companies that take advantage of people who aren't educated, that are poor, that are beyond poor. You know, some of them are starving, like just barely surviving. But in order for them to have some kind of sense of livelihood and benefits of a bowl of rice, some water, whatever, you know, they line up for these kind of shots and things like that. This is happening globally. It's not just what happened here to us as African Americans. And the historical context of not being able to trust people that have oppressed you for the last 400 years, and like, you know, then just jump up and say, okay, right, you know, there are things that we were given before to say we should trust. Well, you know, they gave us the Bible and say, okay, trust the Bible. They gave us the Quran and said, trust the Quran. You know, and I can say this having been both Christian and Muslim. These are things that just as much as data, it's just pieces of paper with writing on it that, yeah, it can be doctored, it could be altered, it could be leaned one way or another. And all of us is in this battle, especially the healthcare professionals, that's in this battle about saving lives. And these are the other things that we're up against as well. This, as Dr. Parsons said, about this whole trust issue of how do we bridge that gap? Because in order for me to trust someone, it takes time and it takes experience through that time to that person being trusted, or that group being trusted, or those people being trusted, whoever it may be, based on tests and results of what happened as a result of us interacting with each other. And in poor communities, you don't have a whole lot of that interacting. As professionals, yeah, we get to rub elbows with different ones, whether in high societies of politics or medical fields or whatever, even sometimes with celebrities, we get to meet with different people. But the less educated, the less financially stable, they don't have those opportunities. And it's hard to explain to them the more technical aspects of medicine and being able to make that relatable to them in a situation where sometimes people just feel like they have today and they're living for today. And they doubt what they're hearing in the news media. They trust more what they're hearing on social media. And these things aren't vetted. The answers aren't vetted, the questions aren't vetted, the people themselves aren't vetted. So, you know, it's very important for us to look at these other dynamics that are actually becoming inclusive and us trying to actually help people heal, people for the world to live. You know, to go back to different things that has been done in medicine. I haven't heard the way in terms of plant vaccines were created in the past for certain diseases, certain viruses. Speaking back to what someone was asking about encephalitis, plant vaccines were used to help in those type of conditions. Where plants had viruses, and then they turned around and used those viruses and vaccines from the plants to help in the healing arts. So there are different other methods that we don't just have to think about synthetic drugs in terms of being the only solution.
Understood. So I want this panel to just kind of always just stay on focus. You know, we've yet to be able to stay within 2 minutes of our answers because there's a lot of knowledge to share. So I want to close out this section, and then we're going to move into the nutritionist and holistic side of it. So I want to close out with you, Dr. Comrie. 2 things to discuss is, are vaccines the only solutions to control mutations? That's number 1. And number 2, can you walk us through how the mRNA vaccines work, right? And how long have those been in use with other viruses? And, you know, was it just introduced with COVID-19? I think we know the answer, but if you could just close us out with those 2. Are vaccines the only solutions to control mutations? That's number 1. And just talk to us about the mRNA vaccine process.
Truth be told, again, I think there are other panelists here because I am more clinical, who could do a better job.
Okay, fair
On
I
enough.
got your
talking
back,
about-
doctor.
So if we want to switch it, let's toss it back to you, Dr. Watson or Dr.
Yes.
Parsons. You know, if you
Yes.
guys want to do that, you know,
I can start.
Mm-hmm.
So no, vaccines are not the only way. There's many different ways that you can limit transmission of the virus. Wearing a mask is a really great way to do that. Physical distancing, keeping 6 feet of distance away from folks, getting routinely tested so that you can break chains of transmission. Those are all things that we can do. Staying home if we're sick. All of that is something that we can do. There's also some other things. There are new treatments that are out there for if you were exposed or you're recently diagnosed. There's treatments that can shorten the course of an infection. There's treatments that can reduce the risk of you going to the hospital and dying beyond the vaccine. So no, it's not just vaccines. I will say for mRNA vaccines, this is, you know, like there's many different ways that you can look at this. We can look at this as glass half empty or glass half full, right? We're living in the future. The fact that they are able to be that advanced to sequence this virus, be able to develop a vaccine that's safe and effective, that they can produce it in mass and be able to get over half of the global population vaccinated within such a short time. When we look at HIV, it took them nearly 7 years to develop treatments for HIV. So we're able to get a vaccine that's proven to reduce death and suffering this short time. It's awesome. And they do it by creating these mRNA vaccines using a basic building block of life, mRNA, something that our bodies are using all the time. And, you know, to help process our DNA, they were able to develop these small chains of mRNA and work with our own body systems to produce these small little proteins that our body can recognize and create antibodies against and activate other types of immunity. All of that said, the vaccines, again, like the understanding has been built on over 30 years of development of understanding how these mRNA vaccines work, using them to try to develop vaccines for other coronaviruses, which were mentioned, MERS, SARS. They're actually experimenting with an mRNA vaccine for HIV. They're actually using mRNA vaccines to as a technology for other for other infectious agents as well. So there's a lot of stuff that is going on, and mRNA vaccines are actually the wave of the future. And I think if we look 2 years from now, 3 years from now, this is as significant as the moon landing, where billions of dollars were able to be put in to get a life-saving limited commodity to communities. That's, I think we're going to be hopefully we'll be talking about this in a very different way, because it is a medical marvel.
Oh, you're on mute.
If you don't want the mRNA vaccine for whatever reason, you can get the J&J vaccine, or you can go to Europe and get one of the others that's not mRNA. But as Dr. Parsons and others have pointed out, those mRNA vaccines have so far worked better than anything else.
Understood. Do we know what's the components or the ingredients in those COVID-19 vaccinations?
Yeah, the FDA publishes it. We can share that out with folks. They have all the full list of ingredients for all 3 of the vaccines available in the United States.
Are any of those ingredients detrimental to the human body?
No, there's some folks who may be allergic to particular ingredients, but a lot of these are, like, it does not contain antibiotics, does not contain blood products, does not contain any animal products, including pork, does not contain any fetal cells, does not contain any heavy metals. So you can look at the list. So basically for the mRNA vaccines, they contain a lot of commonly found things. So there's a liquid component, which is kind of like a saline solution mixed with some like sodium, a few other kind of like things to keep the vaccine liquid. There's also some what we call like these like small fat particles that are used to help protect these not very durable mRNA particles that are the primary component of the vaccine. But I think that lipid component and the fact that the mRNA doesn't last so long is actually reassuring, knowing that our bodies dispose of mRNA within a couple of days is also really important too. But for the full list with all the technical names, you can go to the FDA website. It's readily available.
The only thing that I would add to Dr. Watkins' is a fabulous and like really great description of the issue is that I think that a lot of people hear the word mRNA and they think RNA or DNA, and then they start confusing it with like genetic material. And I just want to be extremely clear that what's happening with the mRNA is happening at a very, very different place than wherever your genetic material is coded. Like your genetic material sits in your nucleus, which is at the very center of your cells. That is not where this mRNA is acting. And so when there's questions about like, well, what could this do to my unborn child? And like, could this affect like generations to come? I think it's really important for us all to just acknowledge the mRNA, while the letters sound the same and might make you think of DNA and might make you like think about your genetic material, they should not, because it is it's just a very similar word for something that's happening very separate and apart from where your genes are stored. Your genes are not stored in the same place that the mRNA is taking action. And so there is no possibility that this mRNA will interact with your genetic code and somehow influence your chromosomes or the chromosomes that you pass on to your children. And that's why when the question was raised about like, has this been shown to be like deleterious to people who are, to pregnant women, the answer is no, because it doesn't mix with your genetic material. It sits outside of that, even though it has a very similar name. I wish they were named something totally different, because that way people wouldn't draw some like similarities between the two. But I really want to make sure that everybody here understands, because even my father, like I'm the only doctor in our family, but my father said, like, I can't believe you're going to vaccinate your daughter. Like, aren't you worried? I'm like, what am I worried about? I'm not worried about it. And he says, well, what if it like mixes with her DNA? I'm like, there's not even a chance of that. Her DNA is stored in a very different place. And I think it's so important. Like, we all have these concerns and these fears, but really understanding, I would take some time. The CDC, I understand that there are issues of trust, and I completely acknowledge and respect those. There are that source and other sources, the New York City Department of Health, they have really good material on how these vaccines work. I find the videos to be extremely elucidating, and they help me remind it's been a while since I've studied all of this stuff, but it is helpful to be reminded of how it all works. And I personally also want, I'm a doctor, but I still want the same assurances that everybody else on this call that wants. Like, I want to know that when I'm giving something, when I'm putting something in my body, or when I'm recommending something to my children or my fiance, that I don't want to be the person who recommended something that was like not good for them. That would be horrible for me. That's like a huge fear that a medical professional might have, that you might be the source of somebody's like ill health, like somebody listened to you and they shouldn't have. And so, we do the research to look at it. And, I think to the issue of trust, unlike in Tuskegee, where it was like one of the most shameful things, I think that is like one of the biggest blights, although there are many, on US history. I would say one of the biggest differences in COVID is a lot of people are themselves getting vaccinated. And that's why I've been so supercharged about getting vaccinated early, vaccinating my entire family. There's not a single person in my family that I'm like, nope, you can't get vaccinated. I will talk them to like they're blue in the face and to get them vaccinated, because I believe in it. And if I'm going to recommend it for other people, I want people to understand that I believe in it so much that I vaccinate everybody in my family as well. It's not just about like what we do to other people. It's what you do to yourself and how you treat. And that's why I want to share that with other people. And I know that doesn't change the issues of trust, but I think that is one thing that to ask. Like, if somebody tells you something that they're recommending that you do to your own body, one of the first questions I would ask them is like, well, have you done it to yours? And if they have, I would hope that endears a little bit more trust,
Right, thank
although
you.
much more is needed to
All right.
really build trust.
One other quick point. One of the things that really confuses the public is when the first line workers, when doctors and nurses are refusing to take the vaccine, then people are really concerned if they're in it and they know it and then they don't want to take it. So that does not help the confusion for the public. We have to empathize with that. And I think the panelists should also talk about herd immunity, just so, so that people can understand what that means.
I mean, if we're going to close it out on that, just somebody just explain herd immunity real quick.
What herd immunity means is that almost everybody's had the disease, so it's not going to spread. We sort of like have that in the United States for smallpox. When I was a kid, just before I was a kid, there was a case of smallpox in the US and everybody was being vaccinated. And after many years, nobody was getting smallpox in the US, and there are side effects to smallpox vaccine too. So they said there's so much herd immunity, we don't have to do that with smallpox anymore. As Dr. Watkins has pointed out, herd immunity is good if the virus doesn't change much. Smallpox is the same now pretty much as it was 200-300 years ago. Measles doesn't change very much. So we have pretty good herd immunity against measles, although that's going down as more people refuse to get vaccinated. Now, influenza changes all the time. So we vaccinate people, people get sick with influenza, and as the other panelists have said, in a year, we need to start all over. But herd immunity means there's so many people that are immune, the disease won't spread.
Understood. All right. Thank you.